Hello. People with diabetes are at risk of developing problems with their feet. This is because having diabetes can damage the nerves and blood vessels which supply your feet. Your foot check has identified that you are at a low risk of developing a foot ulcer. This means that you have normal sensation and circulation of blood in your feet. You do not have any foot deformities, nor do you have abnormal skin thickening, which can increase pressure areas on your feet. It also means that either you, a family member, friend or carer are able to inspect your feet every day to check for any open areas or sores that could develop into more serious problems. This is great news, but you need to keep your risk of foot complications low. Along with your healthcare team, you need to keep good control of your diabetes, cholesterol and blood pressure. This means taking your medication as prescribed, quitting smoking, exercising frequently, and maintaining a healthy weight. You also need to look after your feet. Here are some simple but very important steps you can take to keep your risk of damage low. Check your feet every day. Look for any blisters, cuts, calluses, or areas of thick and hard skin. Check for infection by looking for swelling, heat and redness. You could use a mirror or ask someone to help you. If you do find any wounds, cover them with a sterile dressing and check them every day. Do not attempt to burst blisters. Wash and moisturize your feet every day. Use warm water and a mild soap to wash your feet daily. Make sure you rinse away the soap and dry thoroughly, especially between your toes. Do not soak your feet, as this can damage the skin. When your feet are dry, apply a moisturizing cream, but do not put it between your toes. Cut or file your toenails regularly. Keep your toenails short. Follow the curve of the end of the toe using a file to remove sharp edges. Do not cut down the edges of the nail, as you may create a sharp corner which could cause an ingrown toenail. Check your footwear. Change your socks, stockings or tights every day. Avoid ones that have elasticated tops or bulky seams, as these can cause damage to your skin. Check your shoes to make sure no sharp objects have pierced the sole, and run your hand inside to check for small objects which may have fallen in. Make sure your shoes fit well and do not rub or cause blisters. Avoid corn remedies. These are not recommended, as they can cause damage to the skin on your feet. As you have a low risk of developing a foot ulcer, you will not be automatically referred to your local NHS podiatrist. However, if you develop a problem with your feet, you can refer yourself to the podiatry service. You may be discharged once the problem has resolved. It is very important to attend your diabetes review appointments. You should have at least one a year with your GP. If you notice any problems with your feet, such as wounds that have not healed within a few days, or signs of infection, please contact your GP, diabetes nurse or podiatrist as soon as possible.